Hi everyone, my name's Jo Hardy.
And I'm Fraser Easton.
And we're both respiratory registrars at Southmead Hospital, and we'd like to talk to you today about what a COPD flare-up is and what you can do about it as part of your pulmonary rehabilitation programme.
So what we're going to cover today is just outlined here. It's really understanding what is normal for you, what is an exacerbation, and we are presuming the majority of you are here today because you suffer from COPD, when to contact your GP and what they might do to help, and what happens if you get admitted to hospital.
So an exacerbation is when your symptoms get worse for a short period of time, and each exacerbation affects your health. So it's really important that you know how to recognise a change in your symptoms and knowing what's normal for you, and then knowing how to get the help you need to get treatment quickly.
As many of you know, it is normal for your symptoms to change from day to day, and so really understanding signs of an exacerbation which change from your baseline of symptoms is really important. Try and understand the main concepts of an exacerbation in terms of breathlessness, in terms of if you're coughing more, and if you're coughing up sputum. If you normally cough up sputum, whether or not there's a change in colour and consistency of the sputum is really important.
There are lots of different reasons why you might have an exacerbation or a flare-up in your COPD. They can range from a change in the weather or the season, to continuing to smoke, to bugs that you might come across in the environment, bacteria and viruses, particularly topical at the moment, and also things that are happening in your life, other stresses and anxieties that can have an impact on your overall health and particularly your breathing.
Well, we want to understand, and what you need to understand is what is normal for you. And any changes from normal can be an indication that you're having an exacerbation. So have a think about what is normal for you just now in terms of your breathlessness, what makes you feel breathless even when you feel well, your cough, what your cough is like from day to day, and whether or not you bring up any phlegm normally. Think about your wheeze and what is normal for you in terms of if you have a wheeze and when you have it, and in terms of generally your fatigue and energy levels.
I think the next most important step is to make sure that you have a plan of action and know what to do if things do change. And that's something that you can formalise in terms of an action plan with your GP or your COPD nurse at the GP practice. And that documents formally what is normal for you and what you should do if your symptoms change. And we'll just go through that in a bit more detail over the next few slides.
We're going to talk about mild flare-ups. So if you are more breathless but have no fever or change in your sputum, and remember that's related to what is normal for you, then usually the first step is to use your reliever inhaler more. You hopefully will have been shown how to do this by your COPD nurse at your general practice, or if you've been in hospital recently, then by one of the pharmacists or the respiratory nurses. Make sure you know how to increase the dose of your inhaler, and what's really important is make sure you know how to actually use your inhaler. If you're unsure about this, then it's really important you ask your COPD nurse at your surgery the next time that you see them.
If you were to get more short of breath, even though you've been using your reliever medication more regularly, it may be that you need to start a course of steroid tablets. If you're coughing up more phlegm and your phlegm has changed in colour and become dark yellow or green, looking really mucky, it may be that you have an infection that needs treating with antibiotics. So in both of these situations, it's important that you seek medical help and that you see your doctor for some more advice. We talked about COPD action plans, and as part of your action plan, it may be that your GP gives you a course of medication, including antibiotics and steroids, to keep at home, and that you're given clear guidelines about when you should start your rescue pack of antibiotics and steroids. We've got a point down here that says, remember, and if you were to find you needed to use your rescue pack, it's important that you tell your doctor or nurse, not only so that they can keep an eye on things and keep in touch with you to make sure that you're on the mend and you start to feel better, but also so that they can reissue that rescue pack so that you've got one available if your health were to get worse again.
Really important things for you to remember, and it's about contacting medical attention, either your nurse or your doctor, or indeed the community respiratory team, is when things are not going to plan. This is if you are getting worse more quickly than expected. If you've started taking a rescue pack, if things are not getting better despite steroids or despite steroids and antibiotics. If you are coughing up any blood. If you have any worsening swelling in your ankles. If you've got any chest pain, and something which is difficult for you to realise, but if any loved ones or those close by realise, if you're becoming more confused or more drowsy, all these things are really important red flags, symptoms for you to seek medical attention as soon as possible.
There are some things that you can do, and the first one is to stay calm, which is very easy to say, but when you feel more anxious or stressed, that can impact your breathing. So drawing on the techniques that you are going to learn on this course about how to manage your breathlessness and anxiety would be important at a time of a flare-up or an exacerbation. You should keep using the medications that you've been prescribed, and as I said, draw on the breathing techniques that you'll learn as part of this course.
If and when you do see your GP, it's important to know what really they can do. So they can provide a very good initial assessment of your health, and again they will be able to assess whether or not they are happy for you to stay at home, perhaps prescribe any further antibiotics or steroids or changes in them, or indeed any inhalers or nebulizers. They can also potentially organise any further tests, so think about chest x-rays or blood tests. Indeed, if they think you are more unwell or unwell enough, then they can refer you to a hospital. As Joe was saying, if you have already used your rescue pack, or you do not have one, then that's something that they can prescribe or re-prescribe for you. And something that which I'm sure you'll be told about throughout this course is making sure that you have your annual flu vaccination, and also think about getting your pneumonia vaccine.
And we also run an admission avoidance clinic up at the hospital. So if your doctor needs some more advice about your breathing condition and would like you to be seen by a respiratory specialist, but you're not unwell enough to need to come in and stay in the hospital, your GP can refer you to something that we call the HOP clinic, which runs from Monday to Friday. At that clinic, you're seen by a respiratory consultant and a specialist nurse, and you'd have a full assessment just as your GP would have offered you, but we have more immediate access to blood tests and x-rays and CT scans and breathing tests, so it can help put the story together a bit more quickly and help avoid you having to come into hospital as an inpatient. So that's something that your GP will know about, but something perhaps useful for you to know as a possible option for your GP.
Coming to hospital can be quite daunting, and so having a bit of an idea about what to bring with you so that you're prepared to come into hospital if your GP thinks that that's necessary. So remember to bring a list of your medications. We often see patients who bring in a box of their medications with very neatly listed out, which often helps the doctors and nursing staff who see you initially. This should also include any allergies that you have. If you have home oxygen, then it's important that we know how much oxygen you take, so bring in your oxygen prescription or indeed your alert card. And if you've had any rescue packs or any antibiotics or steroids from your GP, it's really important that you let the nursing and medical staff know which antibiotics or steroids you have taken and when. If you have any recent clinic letters or hospital discharge letters, either from Southmead Hospital or from other hospitals, it's often really useful to bring them too.
As Fraser said, being admitted to hospital can be quite a frightening time, so we wanted to just run through what might happen if you were admitted. So you'd be seen initially by a nurse and then subsequently a doctor, and we'd take the story of your recent illness from you, and then we'd examine you. We'd then decide which antibiotics and steroids you might need, whether you might need some nebulizers, and how much oxygen you might need. During the course of your admission, you'd also be seen by the physiotherapy team, who can help re-emphasize some breathing techniques, and if you have lots of sputum, they can teach you techniques to get rid of that sputum. Some people need to see dietitians, and as part of your pulmonary rehab course, you'll learn a bit more about nutrition and good nutrition and its importance in people with breathing problems. But the dietitians can also support you in that process whilst you're in hospital. And also, whilst you're an inpatient, we can think about any extra help you might need at home, any extra equipment, and any extra support.
Southmead Hospital run an early supported discharge service, which is run by specialist nurses and physiotherapists, and that's for people who we believe could be well supported at home, in which the team performs home visits, gives some telephone advice for around 5 days after you're quickly discharged from hospital. We can put in some temporary measures, which may end up being long-term in terms of oxygen therapy, some nebulizers, and give advice on medications such as your inhalers. All of this is incorporated in self-management, and it's really to empower you and teach you how to help maintain good lung health. They also are a great liaison service between the hospital and your GP should things deteriorate at home.
So in conclusion, we've said here you are not alone. There are plenty of people available to help, and I hope now you feel a bit more confident about who to contact and when. We've talked about the importance of knowing what's normal for you, and I'd take a moment now to think about your normal cough, your normal wheeze, your normal level of fatigue, and make a mental note of what your baseline is. And that will help you to know if and when you're having an exacerbation, if you've got an increased cough, if you're more breathless, and if you're coughing up more phlegm. These are important signs. And I suspect most of you already have an action plan that you've made with your doctor or COPD nurse, but if not, now would be a good time to go and make that with them, so that you feel empowered in knowing how to help yourself, and also you have a formal plan about when to contact your doctor and what they will do to help you. Thanks very much.